Be a bright spot. You never know when a smile, compliment, or kind word can change a person's day.
Good afternoon, and welcome to Bright Spot, a virtual discussion bringing you a dose of inspiration while normalizing conversations about mental health and substance use disorders. This show is presented by CNS Healthcare. My name is Kara Johnson, the Marketing and Outreach Manager for CNS, and today is your guest host. We want everyone to know your mental health matters, and it's okay to not be okay. Today's guest is Tracey Helms, Program Manager at CNS Healthcare, who will be talking to us about crisis services provided by CNS to the community. Tracey, please tell me a little bit about who you are and what you do at CNS.
Well, thank you, Kara, and I want to say thank you for having me here. I appreciate the opportunity to talk about crisis services. Again, I'm Tracey Helms. I am the Program Manager for our crisis services, as well as our adult therapy services and a couple of our young adult programs.
Tracey, can you tell us in a little more detail about the different crisis services that are available at CNS?
Certainly. And you know what, Kara, I forgot to mention, I'm also a fully licensed master's level social worker as a part of, who I am and all that good stuff. So now, crisis services. Currently, CNS has several crisis programs. We have our COPE program, and there's a lot of acronyms, so I'm going to do my best to spell them out for our folks who are watching. COPE is our community outreach for psychiatric emergencies, and it's the stabilization part of that program. And so what our stabilization team does is that they follow up with individuals who have been recently released either from the emergency department, or they recently visited what we call urgent care or crisis stabilization unit. And they're charged with making sure that those individuals are linked to mental health services. The appointment may be a couple of weeks out, or they may not have left with an appointment to a mental health agency. And so our team goes in, they meet them where they are out in the community, and they make sure that they have things like bus tickets, food, clothing, whatever the immediate basic need may be to help them remain stable while they're in the community. They will provide those resources. And then they also stay with them alongside as they make their appointment with their community mental health provider. So that was COPE. We also have our CIT program, which is our community intervention teams. Now, this is great. This is a partnership with Detroit Police Department, where we have clinicians who ride alongside with DPD officers who have been trained in the CIT model. And together they respond to mental health crisis in the community. And the purpose of the clinician is to de-escalate the situation, right? And so there are situations where historically and many other factors that come into play that create a strain in the relationship between police and the community. The clinician is there to kind of be a navigator, a de-escalator, a mediator, and help bring the person down to a point where they can, talk about what next steps are necessary for their care. Sometimes that may mean a petition. They may have to escort the individual to the local ED so that they can get help. But the important piece about the model is that it's a partnership. So both of their skill sets come together to create a win-win situation. Another program we have is our PUC. I told you it was a lot of acronyms. PUC, our Psychiatric Urgent Care Center. So our PUC is located at our Warren Clinic, which is on the east side of Detroit. And the urgent care is for people who have, I would say, mild to moderate psychiatric needs. So oftentimes people who have ran out of their medications, people who may, be going through an anxiety attack for the first time, they're not really sure what to do. We are able to triage those situations and get them some hopefully immediate relief and community resources to help them in the long term. So when you walk into our urgent care, you can expect to see a peer, a clinician, a prescriber, And those, I would say, are the key people that take that person through that process to see what they need. And the unique thing and great thing about the Warren Clinic is that we have a pharmacy on site. We have a Genoa pharmacy on site. So if the person is out of medication, once they see the prescriber puts the script in, Genoa fills it, they're walking out the door with their medication and more stabilized than when they came in. Another program that we have that I'm going to speak briefly about is our program with Covenant House. Now, many of you may know Covenant House is really a national, probably international program for homeless youth ages, I think 18 to 24. But we have a unique role with Covenant House in that we have clinicians on site, on the grounds, that help the residents with their mental health needs. So, and the reason why I'm putting this under crisis services is because we are charged to intervene when they are experiencing crisis. So we really work tightly with the Covenant House staff in partnership that when the residents are experiencing a crisis, we're able to kind of jump in, intervene, and help them with next steps. For example, just recently, we facilitated a training with their staff on how to fill out a petition. So some really great work going on there. And then last but not least is our CCP program, and that's our community counseling program. Now, it just ended. It was a grant funded through SAMHSA and FEMA. And the goal of that program was to go out in the community and educate people about counseling services that were available for survivors of the flood. As many of you might have experienced, or at least you're aware, that Metro Detroit area went through a tremendous amount of flooding in the last year or so. So this was in response to that. And we had a great opportunity to canvass the neighborhoods and provide that information with, community referrals and, again, information about how they can get counseling. Wow, so that's crisis services.
Yeah, all of those amazing programs. I wish we had a whole show to dive into each one of those individually because they really deserve it. Just a couple quick follow-up questions for our viewers. CIT, the partnership with the Detroit Police. How long has CNS been doing that, and what sort of results are they seeing?
Wow, that's a great question, Kara. That function of the clinicians pairing up with the police officers, believe it or not, has been in the community, at least the Detroit community, for, 15, close to 20 years. But what happened more recently is that our funder, or our PIHP, which is DWIN, kind of, I don't want to say revamped, but retooled the program within the last, I would say, 4 years. And they really expanded the depth and breadth of what that program can offer. So I would say, that was kind of a long answer to your question.
That's great.
5 years, maybe 4 or 5 years, CNS has been in this iteration of the CIT program.
Awesome. Appreciate those details, Tracey. Thank you so much. You mentioned before you also oversee the therapy program at CNS Healthcare for adults. Can you talk a little bit about the benefits of therapy?
Absolutely. Studies have shown that, especially when people are on medication, that medication and therapy together give a higher likelihood of success. And so, a lot of our locations, our clinics, we know we have a lot of people receiving psychiatric medications. And so being able to have that therapy also a part of their treatment plan, again, it just strengthens the likelihood of them remaining stable, remaining compliant on their medications, and really learning some coping skills and strategies to help them kind of just, with their quality of life.
Now, some of us might know somebody that could maybe benefit from therapy, but they're not sure that they really want to start there. How would you recommend starting that conversation?
Sure. So one of the things is that you don't want to be judgmental, right? Anytime you're working with someone who is under distress or stress, one of the first things you want to do is just validate their feelings, validate where they are, meet them where they are in the moment. Hey, I noticed that you've been stressed lately, or, you've been a little irritable lately, or I know that you just experienced the death of your loved one, and, you've seemed a little down these last couple of weeks. So starting the conversation by validating, what you're seeing in terms of their emotional state. Once you get beyond that, then it's like, hey, have you ever thought about seeing someone or being able to talk to someone? And some of the benefits of a therapist versus a family member or someone is that objectivity. We're not there to judge. We're not there to give advice per se. We're there to help the person, find the solutions within themselves, what they have the capacity to do, and offer and suggest different tools that can help them get there. So again, when you're talking to someone, try not to make it a command. You need to go see a therapist, because nobody, especially adults, like to be told what to do. Validate what you've seen, right? That's that empathy piece. Validate what the feelings that you've been seeing or observing, and then say, hey, have you ever thought about? So that way the conclusion and the answer comes from them, not you telling them what to do.
Oh, that's so well put and very, very well presented, Tracey. I appreciate that answer. If you're just joining us, this is Bright Spot, your community connection to wellness, presented by CNS Healthcare. We are speaking with Tracey Helms today from CNS Healthcare about crisis services and responses to mental health emergencies in our community. A couple more questions for you, Tracey. We know life in 2022, a lot of things have changed since COVID, post-pandemic. How have you seen that mental health and crisis has changed during and post-pandemic?
Well, during the pandemic, it was a huge shift, because we were accustomed to a lot of things being in person, on site. And so a lot of things shut down, because of COVID. And so what that did is it put people in positions of isolation a whole lot more. So people who suffer from drug addiction didn't have the access to on-site groups. People who are suffering with, mental illnesses, they didn't have that ability for connection when the pandemic happened. And so, certainly and unfortunately, we saw increases in drug overdose and, psychiatric visits, psychiatric hospitalizations. So, COVID really it was triggering, and it was isolating for a lot of people that, suffer, like I said, from mental health and or drug addiction. Now, some of the good things that have come out of that is telemedicine. Even though, eventually we're going to move back slowly but surely into that on-site in-person connection. But what the telemedicine did during that time was, again, it increased access for connectivity. So the therapist could meet with their person via telehealth and see the person, right? And groups could be done virtually. So again, and for those where their basic needs were challenges before, like if they didn't have transportation, or they got to find babysitters, or, some of those barriers were removed by being able to offer the telemedicine. So that was one of the good things that, came out of COVID. And so as we kind of transition back into our new norm, as I like to call it, again, like I said, one of the things that you can expect is us being able to offer more on-site, in-person services, because nothing beats the in-person, where you can really see, feel, and observe people's body language, nonverbals, things like that. And the same for our community programs, in terms of being able to go in the homes and kind of see how they're living, because all of that plays a part into their mental well-being.
It is good to remember that there's some silver linings from the pandemic, but I agree with you, Tracey. We're doing this now, of course, recording it virtually, putting it out to our audience virtually, and there's nothing like being in a room and picking up the vibes from other people and just seeing them in person. But we're glad to be able to share the messages and provide services, as you said, in the way that's best for people. So I just have one more question for you. I know all of our viewers have been locked in from the beginning to the end, but in case a couple people are just joining us now, I want to give them, if they remember nothing else, remember this. If they or someone they know is in a mental health or substance use crisis right now, what steps should they take to make sure everyone remains safe?
Absolutely. So, great question. So, if they are in crisis, if it's a serious crisis, they should call 911. They should still call 911 or go to their local emergency department so that that situation can be triaged. And that's, I mean, if somebody, for example, is, they are in the midst of a suicide attempt where they've ingested a bottle of pills, there's no guessing there. You need to get them straight to the ED. Now, if we're talking about a crisis like, I ran out of my medication and I don't see my doctor for the next 2 weeks, that's the beauty of the urgent cares that are available and the crisis stabilization units. And so there's a couple, there's Hygera in Livonia that is open 24 hours that they can go to. There's also Team Wellness, which is on the east side of Detroit. And both of those facilities are 24 hours. They're not emergency rooms, but they are still equipped to provide assessment and level of care and things of that nature. Now, below that, mild to moderate crisis, and again, the crisis is unique as the person. But again, giving the example of they're out of medication, they think they can cope, but they know they just want to kind of get ahead of the game before it gets bad. Then they can come to a place like us, our PUC, where they can see the counselor, they can see the prescriber, they can get the medication and kind of, be on their way to remaining stable. So that was a lot of information, I know. But when in doubt, they can always call, again, 911, or they can even give us a call and, we can triage the call and send them in the right direction if they're not sure.
A lot of information, a lot of great information. Thank you so much, Tracey. And thank you, all of our viewers, for joining us today for Bright Spot, CNS Healthcare's new virtual show. We hope you'll mark your calendars and continue to join us the second Monday of every month to discuss feelings, struggles, and finding one's way. If you have a topic that you want to hear discussed, please drop it in the chat or comment on this video. Remember to be a bright spot. You never know when a smile, a compliment, or a kind word can change a person's day. Have a great week.